The colon has a role in storing the feces or the stool, and also it helps in absorbing the water from the stool itself. Colonoscopy is performed for two major purposes. One, diagnosis, or trying to find the source of bleeding. My name is Dr. Amr Al-Kati. I'm a staff physician at Digestive Disease Institute, Cleveland Clinic, Abu Dhabi. Colonoscopy is commonly performed medical procedure. During the procedure, the physician inspects and examines each segment of the colon. Colonoscopy has two major roles. The first one is to make a diagnosis. The second role is therapeutic. For example, somebody presenting with a bleeding, you advance the scope inside the colon to cauterize the area where the bleeding is coming from. Therapeutic colonoscopy is very efficient. It can control the bleeding or achieve the diagnosis in the vast majority of the cases. Polyps are small, tiny tissues that patient may have inside their colon. With the new technology, using different type of lights, it makes it easier for physicians to find these polyps, identify them, and remove them from the colon. Preparation for colonoscopy is an essential part of the procedure to achieve the ultimate outcome. What we ask the patient essentially is to follow certain diet before the procedure, and then the patient has to drink laxative that will help to clean the colon. The vast majority of our patients will be under light sedation. The patient does not feel anything. The duration of the procedure varies. It ranges from 15 to 30 minutes. The physician advances the scope to the end of the colon. Once he reaches to that area, the scope gets pulled out slowly. During withdrawing the scope, the physician inspects the inside of the colon. If the physician finds any polyps, he would remove these polyps. During therapeutic procedures, the physician may have to control a bleeding source. The physician can perform that by applying heat or clip or injecting certain medication to control the bleeding. The patient gets transferred to the recovery area. In the recovery area, we observe the patient for around 30 minutes to ensure that the patient has not had any major complication. After that, the patient is free to go home. The patient usually has a follow-up appointment with his physician. During this visit, the physician will discuss with the patient the result of the biopsy, if any has been obtained. Based on the biopsy results, that will determine if the patient will need another colonoscopy in the future. Colonoscopy is considered a very safe procedure. However, there is a slim chances of potential complications. The vast majority of these cases can be treated conservatively. Colonoscopy is a medical procedure, very simple to be performed, very safe for the patient to undergo, to diagnose underlying problem or treat underlying condition.